Nearly 40 million adults in South Africa. Only 20% of them have received at least one COVID jab. That's 1 in 5 adults, according to stats supplied by the Health Department. I'm joined now by infectious disease specialist Professor Francois of Ezintsha, which of course is based at Wits University. Prof, thank you so much for joining us. So is 1 in 5 adults with at least one dose so far, is that good progress?
No, it's not good enough. And we've got some heroes on the front line who've done that, who've got us to those 1 in 5. But if we're going to avoid another wave of terrible death and long COVID disability, we really need to go faster. And we particularly need to be paying attention to the over 60s. We keep dropping the age threshold, and then we get a rush of people who desperately want their vaccines. But that masks the fact that we are woefully behind in terms of numbers. By my calculations this afternoon, if we don't speed up, we're only going to get to 2/3 of the population by the middle of next year, which means we'll be firmly into a 4th, 5th, and potentially even won't be anywhere close to vaccinating the full population by a 6th wave of COVID.
So let's talk about the ethics of it. Do you think it is ethical to make people have the jab? We understand that this is something that's being discussed. Some say that Cyril Ramaphosa should never have given South Africans the options. What is your view from a medically ethical perspective?
I think that you can make the ethical argument that to have a vaccine mandate, that you can force people to have things done. You know, there are lots of things we do in the society to operate in the society that government and the legal system requires of us. From a public health perspective, it's often much better to try and persuade people to do stuff. And I think this term vaccine hesitancy is thrown around way too liberally. People often just have some concerns. Sometimes those concerns are relatively minor, sometimes they're completely legitimate. But if people would just take the time to explain them to people, you wouldn't see this hesitancy. One of the most primal things I've seen in terms of motivating people is seeing somebody with long COVID, seeing somebody who's short of breath, somebody who's very, very tired months after they've had an infection. And that's been a real motivator for people to come forward and get the vaccine, the fear of ending up like a friend or a family member who's been temporarily and perhaps even permanently disabled by the virus.
You know, and as you talk about that, I think about what happened when HIV/AIDS was becoming a massive problem in South Africa. We had a president at the time who didn't admit there was a link between HIV and AIDS, so there was a massive sort of political will issue. But in terms of communication around AIDS, do you think that it only became effective, the message, when people saw friends and family dying?
No, I actually think that with AIDS it was so difficult. You know, there was far more of a realm of shame attached to it. I think there certainly was confusion. You know, the politicians at the time playing silly politics, which cost hundreds of thousands of lives at the time. At least, you know, we're not having any problem with the science of government here. Some of our leaders of the different political parties certainly could do with a few science lessons. I think the problem here more is, to my mind, is that, you know, Dr. Crisp, who heads the vaccine program, and the new health minister, Joe Pake, should have the power to insist that every arm of government, every arm of business, every arm of the private sector, the medical aids, are single-mindedly focused on getting the vaccine out there. And my sense is it's kind of been delegated to the health system. Again, as we saw with the HIV response. And we just cannot have that. We shut the entire country down for 3 months last year. Everybody's invested in us getting this right in terms of getting back to normal. The only road to getting back to normal is a mass vaccination program that will mean we can get back to schools, we can get back to work, we can get back to a society where we're not hiding behind masks. And that requires everyone to get involved, not simply handing it to the health department and its various sub-departments and saying, get on with it.
It was interesting listening to the Limpopo Health MEC, Poppy Ramathuba, who was speaking to Clement a little earlier this afternoon, and she was talking about she would love to see liquor outlets saying, if you're not vaccinated, I'm not going to sell you alcohol. I'm not sure that will actually fly, because I think these retailers are desperately in need of making money to stay afloat. But she did speak about that we should start a campaign where if you haven't been vaccinated, I won't date you. And she compared it it to the condom campaign with HIV/AIDS. And it struck me that perhaps we're going to have to see campaigns like that rather than expect the health department or government to do really specific interventions. What is your view? Do you think that sort of thing could work?
I agree. Absolutely. I think those kind of creative things are what's required. I don't understand why every supermarket chain isn't saying, if you're over 60 and you have and you can show us proof of vaccination, we'll give you 5% off your groceries. We know those incentive programs are very powerful in South Africa. That is one of the most sophisticated incentives. I mean, every one of us probably has several loyalty cards in our wallet at any one time. You know, and I think they're trying to play into the strength of that, to incentivize things rather than use the stick, use the carrot approach. And I suspect that, you know, the supermarkets, the liquor license, the liquor stores, the pharmacies, everybody is invested in us getting back to a normal society where our economy can start growing again, would participate in something like that. So those kind of carrots rather than sticks are the way I certainly would go initially.
I want to ask you a little bit more about the science and where we're going. We're seeing that a lot of countries that are mostly fully vaccinated are now looking at boosters. In South Africa, we've got the Johnson & Johnson, which is 1 shot, Pfizer, which is 2. Do you think that quite soon we're going to have to look at booster shots in South Africa? And if so, how soon?
I think that we can afford to wait for the science to come in. A lot of very smart people are looking at boosters. I think these countries have leapt forward in a way that is unethical. You know, to say that whole chunks of the globe are unvaccinated and we're going to take a big leap of faith with no real data to support, well, certainly no clinical data to support it. There's some immunological data to support it. But in the absence of that, to leave huge chunks of the globe unvaccinated, I just think is grossly unethical. I think for South Africans to keep an eye on this, not to worry about, and certainly not to go and grab Granny's vaccine and, you know, use it on yourself would be obviously wrong. At the moment, what data we have is that the J&J and the Pfizer vaccine are working remarkably well at doing its work, which is to keep you from getting very sick, from keeping you from dying. So you can, you know, we've bought ourselves, those people who got vaccinated, you bought yourself some time. You don't need to panic yet. You can keep your eye on what's happening in the scientific literature. It will be front page news when it happens. What's more important at this stage is to get the people around you who are unvaccinated through the door as quickly as humanly possible.
Thank you so much for chatting to us this evening, Professor Francois of Ezintsha, based at Wits University.